everybody. I'm Michael Munson with Forge, and I'm really happy that folks are joining us today for this conversation about looking at how we can stay safer when we want to engage in protesting or marches or rallies. And we are joined today with Joanna Woodbury from the Medical College of Wisconsin and Andy Petrol, a physician at the Inclusion Health Clinic. This is a part of a project from in partnership with Forge and the Medical College of Wisconsin, funded by Advancing a Healthier Wisconsin Endowment Fund. We're really glad that folks are tuning in because we know that a lot of folks are protesting right now or engaging in rallies or marches or otherwise doing kind of some civil disobedience or engaging in public action where they are out in public with other folks. So we wanted to talk a little bit about how to make those interactions a little bit more safe and a little bit more sane for folks, and how we can stay protected as much as possible from COVID-19. So we're going to have kind of a relaxed conversation today, and we will see where we go. We've got a couple of areas that we know we want to cover, but we may stray into some other territory as well. Can the two of you, are you willing to give a brief introduction of who you are so that folks can know your smartness?
Thanks, Michael. Well, sorry, since I started talking. I'm Andy Petrol. Thanks for getting us together, Michael. So I am an associate professor at the Medical College of Wisconsin. I am by training an infectious disease specialist, and I am the medical director of the Inclusion Health Clinic at Fredericton MCW, which is, as you know, Michael, a clinic that caters to LGBT health and our community to provide excellent care in an affirming and welcoming environment.
Great, thank you.
I'm Joanna Woodbury. I direct HIV care and prevention for the Medical College and social services for Inclusion Health Clinic. I am a social worker by training and provide social service support in Inclusion Health.
Perfect, great. So like I mentioned, we're going to talk about protesting and what that might look like. And so there's a lot of different things that people might want to think about. And some of that might be before they leave their house about kind of what the things are that they may want to bring with them if they decide that they want to join one of the protests or rallies. So what are some of the things that people may want to pack in their backpack or bring along with them?
Sure. So I think probably among the important things are, the most important thing is probably a mask most important thing as far as COVID-19 prevention. So we know that masks can reduce the likelihood of transmission between people. So that's probably the most important thing a person could do. As far as the kind of mask, it's still a little bit hard to get masks. So basically any mask is better than no mask, but if you're able to buy or find a mask that has more than one layer of fabric, 3 is supposed to be the best, and or like a filter that inserts into it, those would be kind of the ideal things as far as what kind of mask to get. Of course, you need your mask to be comfortable, otherwise you won't want to keep it on. So that's also kind of as important, because if you get like a really heavy duty mask that you don't keep on, then it doesn't really help a person out very much. And then probably the other main important thing is a way to clean the hands, which is usually in an outdoor event is usually just hand sanitizer. So the point is just to get something with more than 60% alcohol, which is what's needed to kill most germs, including coronavirus. Joanna, did you have any other ideas on this?
I would add that what I've chosen to do is also bring a bag, so that just like when I am at the hospital at work, when I go home, I immediately take off things and put them right in the washing machine. So if you have an outer layer of clothes that you've been wearing that can come off before you go in the home, you can put it in the bag and just take it straight to the space in your home, or the space that you would reserve to get laundry done. The other thing I would mention is when you're wearing a mask, a lot of times I've seen people out and it gets hot, and so people do this with their mask because it's easier to breathe this way. But that allows for a lot of spread, and so making sure you're putting your mask over your nose so that it's covering all of that is a really important piece in in when you're masking yourself.
You know,
And
I've
that's
seen
when
it,
you're out and for anywhere,
yeah.
so whether you're at the grocery store or in a protest space.
And I keep on seeing people that when they start to talk, their mouth moves and then the mask starts to slide down. Are there masks that have like more of a clip or something that will help keep it up for folks if people are looking to find a mask?
There are different varieties of masks. What's I would say is, trying different ones if you're able. And so there are masks similar to the one that I just tried on that has a bar at the top that allows it to kind of pinch at the nose. There are other masks that just seem to fit the face, like in a specific shape. That I have one, but just not in the space I'm in. And that doesn't have a bar at the top, but it just seems to kind of mold around that part of your face a little differently. So just, being mindful of how you wear the mask and that it fits. For some people also, it can not fit here either. And so then when you're talking, it's kind of riding up that way. It can get really frustrating. And what you want to avoid is touching your face as you're out, trying to maneuver your mask, because that defeats the point of having a mask and all of that. So if you do have to touch your mask or your face, using the hand sanitizer that Dr. Petrel mentioned would be important to do before you start kind of maneuvering around your face.
Excellent. That's cool. And I know, like, as a bigger person and person with a beard, I tend to look for masks that are larger, that do kind of cup underneath the bottom of my chin a bit more so that it doesn't ride up or ride down. Joanna, before we just started this call, you showed us some of the masks that we'll be having for distribution. Do you still have that? Could you just do a little show and tell with folks?
Yep.
So just to let folks know that we are happy to send you a mask, because we know that not everybody can afford them or find them, but, this is one option that you have that we would be happy to provide for you if you want to get in contact with us.
So these masks have the feature that I just described, which is a bar right at the top that allows it to bend. So that bar would go at the top of your face and pinch around your nose. And then these, so you put them on, they spread. So it gives you space to put around your face in a way that fits. They also have a pocket on the inside that would allow you to add kind of a homemade filter. A lot of folks I've read are able to put like a coffee filter in there that kind of thickens it up a little bit, but still makes it breathable. And then it just hooks right behind your ears so that I don't contaminate this one. It's just like this, and it just slips right over there. So you get that on. You pull it down, you pinch at the nose, you're good.
Good. Excellent. So clean hands, pinch at the nose. Don't touch it again after you get it on if you can help it. Cool. So people are bringing a mask, some hand sanitizer, probably a bag to put their clothes in when they get back home so that they can take those clothes directly to their laundry area. Is there anything else that people should be wearing or bringing when they're going out to be in close contact with people?
So another thing that, we think about, especially in a hospital setting, but is probably a good idea if it's possible for people, is some kind of eye protection. So, at the hospital, we wear pretty heavy duty, either a shield around that kind of goes around the head and has a clear shield, or kind of goggles. And that may be a little bit much for being outside, and especially if it's hot. But if a person has a choice to wear like glasses, or if you have some kind of big sunglasses that you like, that offers some protection over the eyes from particles in the air getting into the eyes. We don't really know for certain if regular kind of glasses are not designed to kind of keep everything out except the sun perhaps. But it probably is a better idea if you have a choice, or if you can pick kind of a bigger, heftier pair, like the ones you wear when you're riding a bike that are a little more goggle, like that would probably be a good choice.
Perfect. Good. I'm wondering about if folks want to go, sometimes when we go to rallies, we want to wear shirts or clothes that really kind of speak to the issues that we care about the most. So I'm thinking that a lot of trans folks that go to protest or rallies may want to wear a t-shirt that's trans affirming or trans positive or sends a trans message. So this might not be exactly about COVID-19, but like, how can folks make the decisions around their safety about, might they get some pushback from other protesters if they're wearing trans-specific clothing, or, making it more about COVID-19, what if somebody yells in their face some anti-trans epithets because they're wearing trans-affirming clothing? How can they navigate some of that territory or decide on their risks?
Well, I was hoping Joanna was going to speak right up there.
I mean, I can get us rolling with that. I mean, I think
I got
part of what I
stuff
said
too, but I
too
thought I'd let Andy go first.
was that we all need to kind of assess our risks. And so, if we feel really confident that we are feeling really good that day, and we feel like we're able to kind of ward off any negative things, we may want to wear that t-shirt that has something trans on it. And if we're not feeling like we want to have potential confrontation, we may not want to wear that on that particular day. So, I mean, that would be one of those kind of like weighing your own personal, not risk, but feelings of confidence to potentially engage with somebody that might be less than positive. So that would be a starter for me. And then, how to deal with conflict is a bigger challenge, I think.
Yeah, and I think conflict or not, when we're in a really large group like that, we can lose a sense of personal space, and that's a challenge, whether there's COVID or there's harassment or both. And so, choosing where you place yourself in the crowd can be helpful. And, it's hard to maintain 6 feet of distance if you're part of a march, but maybe choosing where you go and what you do so that, if you can go to an event, first of all, that you might feel most comfortable in. There's lots of events that are LGBTQ affirming and, Black Lives Matter affirming right now. But staying on the outside, or if you're going to one that's not marching. So for instance, in our home, we've decided for a variety of reasons that we are controlling our risk by going to things where it's kind of stationary. And that allows you to kind of be further on the outside of things, but still be part of it. And then placing yourself in a space that, hopefully there are people that would help intervene or be protective. And we've actually seen that a lot in the news of kind of people protecting each other from conflict. And whether it's conflict or not, trying to keep that 6 feet distance. And if you're having an interaction where someone is kind of more in your space than you want, taking that step back or turning your, so that you can hear somebody instead of hearing somebody face on, just trying to position your body in a way that can be more protective. This is a difficult thing, especially because our instincts kick in, right? And we don't do this when we want to communicate with somebody.
Right. And, I realized I phrased this in a really negative way, that people might object to somebody's trans-affirming shirts. And I was realizing that, people might be excited to see somebody with, like a Black Trans Lives Matter shirt on and want to go up and hug them. Mm-hmm. So there may be some positive affirmation that's happening if somebody wears a trans-affirming shirt or trans messages. So again, it's kind of like, how do we navigate somebody running up to you and wanting to hug you, consensual or not? And how does that increase the risk? So again, it's kind of figuring out who you're with and how to say, no, let's do a high five or a fist or an elbow or something instead of that friendly gesture.
There's other ways, I think, to mediate that too. When we carry signs, it's harder to interact that way, right? If I'm holding a sign, my body doesn't say, come hug me. When my family protests, we have our kids put their hands in their pockets. Because if your hands are in your pockets, you're less likely to be grabbing things. And that's a logic for a little body that isn't thinking the way I might, but it can be helpful for me too, that just remember, grabbing onto people or grabbing onto other signs, or just, kind of limiting that contact can be helpful just in how we hold ourselves.
Yeah. And, you brought up kids, and that was another thing that was kind of on my list. So can we talk a little bit about kids now? Because, trans folks have kids too, or non-trans folks have trans kids, or trans people have trans kids. If people want to bring their kids, what are some of the added risks? Like you said, like sometimes kids want to do things with their hands. So one strategy might be to, like you said, have kids put their hands in their pockets. What are some other ways that, if folks want to bring their children, that they can keep their kids safe and other folks safe?
So the things that we've done in our home is, first of all, making sure that our kids' masks fit, Because if they do not fit, they will not wear them, and they will fall off, and they will be grabbing them, and they will get sweaty, and they will hate them, and they will complain, and all of the things. So making sure that you have masks that fit your kids. We also have our children hold the signs for that deliberate mechanism of like giving you purpose and something to do with your body if they're comfortable. One of my children can't stand holding a sign, so he keeps his hands in his pockets, and he actually really digs that, so that works for him. I have seen other families, putting children in like a wagon just to kind of control where they're spaced, so that, kids can get out of a wagon depending on their age, but that does seem to kind of help. They'll decorate the wagon sometimes with their messages. I have seen that families who bring kids with other like things to do with their hands, like whether it's waving, a pride flag or something else that just keeps them occupied physically, and it also kind of stimulates their brain, right? This is a big moment, and depending on their age, they may be reading lots of signs and asking questions, or they may just kind of be present and witnessing and needing some kind of interactive experience themselves.
Dr. Petro, do you have anything else to add to the kids being in spaces?
I think Joanna covered it. I think, at whatever age one of the kids can start wearing a mask, that's the age to start it at, and that'll vary, and even probably on a particular day how much they'll put up with that. But yeah, I think especially if people around are kind of modeling wearing masks, that might be helpful to kids, and also if their mask can be something that's fun for them. It also has to fit, as Joanna mentioned.
Yeah, there are some pretty cool masks out there that have, superheroes and fun characters and fun patterns on them. So I would think it's fun for kids to wear and be able to see each other with fun masks.
And I would add, we've leaned into the like make it really fun, right? Like ninjas wear masks.
Yep.
Right?
Exactly.
Like there are all sorts of fun things that like we can turn it into, even like whether you're protesting or you're trying to go out, right? Like there are ways to try and reframe this one so that it's not so scary, because it can be scary depending on the age of the child about why I have to cover my face and why others are covering their faces, and giving it some intention and focus.
This conversation is reminding me that we just launched and haven't really pushed out very much yet. We're doing a t-shirt design contest, which we normally do for Pride. And this year, the theme that we've picked is superheroes wear masks to protect their community. So we're hoping to get some t-shirt designs that are kind of playing along that funness of, it's fun to wear a mask. You can be creative in that process. So hopefully people will have cool t-shirts to wear at the end of the contest. Can we talk a little bit about how we actually get to protests? Because not everybody has a car, not every protest is really reachable by bus, but sometimes people wonder about like, well, should I get in an Uber, should I get on the bus? Where and how are the safest ways to get to a protest or march?
Sure. So I guess starting with public transportation, the bus services have generally done things to make the buses safer, meaning that they don't take very many people on the bus at the same time, which could potentially make it harder to use the bus depending on when you'd like to go. But the same thing would apply, is trying to keep distance between yourself and other people if you're riding public transportation. Again, that's an enclosed space, so the risk is probably a little bit higher than in an outdoor space. Of course, there's a bunch of surfaces inside of, like, say, a bus. So making sure to keep your hands clean if you decide to use the bus, before you, would touch your face or when you're done riding. As far as comparing that to other spaces, like, say, a car sharing service, one aspect of this is how many people you're in a space together with. So if you're in a space with, one person that's driving you or your group, compared to being in a bus with up to maybe 10 or 12 people, fewer people is probably a bit safer. Although when you think about it in the context of going out to a gathering with a lot of people, I'm not sure how much difference it makes anymore as to that choice, as far as whether to use like a bus versus a private car. So I think in that context, I think that, this conversation is about I think it's about helping people figure out what kind of choices they want to make. So if a person's choosing to go out to be at an event with a lot of people, I think it's probably maybe not worth as much toil over what the method of getting there would be, because probably the higher likelihood of encountering COVID would be at the actual event when there's dozens to hundreds or maybe thousands of people in the same space, even though it's outdoors.
Yeah, that makes a lot of sense. So when you're talking about large numbers of people, let's talk about when we get to a protest or a rally. Joanna, you mentioned that you kind of like ones that are stationary, but a lot of folks are doing ones that are marching. If folks are marching, where's the best place to be? If you're stationary, where's the best place to be in terms of mitigating risk?
Yeah, I think you can still practice that kind of staying on the borders for a variety of reasons. One, it's easier to get out if you need to stop for some reason, or we talked about there being conflict or enthusiasm. It's just easier to maneuver. So whether that's on the edge or towards the back, there are also a lot of these caravan marches where people are actually in their cars. So if that's an option for folks who might feel nervous about the risk and have the capacity to be in a vehicle, that can be an alternative to being in a walking. You can be in a driving. And a lot of times those are actually kind of commingled, where there'll be like a caravan, a walking, and a follow-up caravan in one large group. And Andy, would you add anything to that?
No, I think there's probably a variety of considerations, right? If you're, as far as just overall safety, if you're at the center of a group of people, maybe you're safer from potential harassment, from people outside of the group, but you're probably at a higher risk of encountering, COVID. So I think it's a little bit tough, and I think this conversation just points out the things that people can consider in the space that they're going to, and think about what seems most important at the time.
And I was thinking about this question and thinking about how, a lot of trans folks have a lot of trauma. I mean, we all have a lot of trauma, whether we're trans or not. And, sometimes being in the middle might feel really claustrophobic. And, Joanna, like you said, it's easier if you're on the edges to kind of peel off and get out quicker. If somebody's having a panic attack or feeling really overwhelmed by the stimulus of the crowd. So that's not about COVID, but about post-traumatic stress or some other anxiety that people might be feeling. And obviously, if people are feeling anxious or having a panic attack, they may be breathing heavier, and that might, increase their risk as well. So, if folks have that propensity to be anxious, the outsides might be better for that reason alone, and then weighing the other risks around infection and position. That's cool. Anything else about where people position themselves?
I don't think so. I would add what you just said, though, reminds me that bring your own water. There are a lot of ways to participate in these protests. If you are not comfortable or able to march or to drive, there are a lot of us who are contributing water or food for people who are marching. And so you'll see perhaps as like a march passes through, you might see people kind of run up with like bottles of water and food to hand out to sustain the people who are, in many cases going for 20 miles. Exactly. And so hopefully, if you are someone who's doing those lengthy walks, there will be people contributing to that, but you could also be the person to contribute to that. And if you are doing the marching portion, make sure that you start with your own water and keep yourself hydrated. And, I'm thinking about if you need to step out because you're feeling overwhelmed, taking some deep breaths and having something to drink can be really helpful to just kind of regulate a little bit.
Yeah, exactly. And one of the things that we didn't talk about like what to bring is I know that a lot of people are suggesting to bring a backpack or something that you can put things like your water in, or sunscreen, or an extra mask, or something like that, so that people have the supplies that they need as they walk along. So you're mentioning things like about people handing out water or food, which we've definitely been seeing a lot of. Is it safe to, hand off a bottle of water to somebody, and should we be worried about the surfaces of that bottle when we're handing it from one person to another?
So, we do talk about, every time we talk about COVID, cleaning people's hands. And the main thing about that is to clean a person's hands before they will touch like their face, meaning like around their eyes or their nose or their mouth. So, getting something handed to you isn't inherently and immediately dangerous to you. It's what happens after that. So if you get a bottle of water and you drink it and then you clean your hands off when you're done, you should be in fine shape. So it's more like you hold on to the bottle of water for a while, and then you're sweating and you start touching your face and stuff before you've cleaned your hands. That's a different kind of consideration. So yeah, it's a potential issue, but I think if people try to follow the principles of keeping their hands clean, especially after you get an object from somebody, but there's not like an inherent risk, right? You open the bottle of water, you drink from where it hasn't been opened, and the water is fine, but it's more about what you do right after that.
Okay, so we probably wouldn't want to like put the bottle of water on our forehead, where we're putting, that's closer to our. I'm just, I'm semi-teasing, but it's like it is a lot closer to our eyes, and maybe we don't want to put the bottle of water to cool off.
That sounds like great advice, Michael.
I'm sorry. That's just my it's got to be closer to your eyes. It must be more risky. So maybe not really. So if we're going to drink some water, we can't drink water through a mask. At least I don't think you can. So what is the protocol for getting a drink?
Sure. So of course, we all have to eat and drink. And, during the time that you need to eat or drink, right? If you have some room available to you, you can go off away from people and then remove your mask and consume whatever you need to do. That would be probably the best thing to do, right? So then you're basically not really placing yourself at risk if you're away from people while your mask is off. So that's the ideal thing, if it's possible. Of course, if you need to just briefly take off your mask to drink water, I mean, obviously there's a health risk of becoming dehydrated and other issues that can come from that. So that's also kind of needs to be considered in balance for people that are out in the sun and things. So yeah, I think briefly removing the mask is just one of those things. So it's about kind of the overall risk, right? So the longer that someone is without a mask, right, the higher the risk may be. So if it's just a brief period of time, it's not something that people need to necessarily worry about. And if that period of time can be away from people, that would be ideal.
Cool. And so like if people are eating, obviously, to me, at least obvious to me, good hand hygiene about before you eat, you should wash your hands. So, that would be an ideal way. So use that hand sanitizer before you have a sandwich, if you get a snack, and then you can wash your hands again and then mask up.
That sounds perfect.
I'm sorry. That's my, let's be food conscious and what we do when we're going to be really close to our mouth. So again, that's maybe not as much about COVID as just about general, safety for all those little fun germs that are out there. When we're talking about water, and this is a little bit off of COVID as well, but I'm thinking about, a lot of trans folks have challenges finding restrooms that are safe. And so it's important to stay hydrated when we're out and marching. What do you know about, I guess I have not been on the streets, so I'm not sure of like where people are peeing and if that is becoming, a lot of risk for trans folks, because we know that trans folks will oftentimes not drink very much, so they don't have to worry about using a public restroom. So, we obviously want people to stay healthy and not pass out and not get dehydrated. Comments or suggestions for protesting in the heat, drinking water, and where to pee?
That's a really good question. And it's something that I was thinking about last week. I don't know. For folks who are marching, 5, 10, 15 miles, I'm not sure if people are stopping at gas stations. Most restaurants are open in a limited capacity and like aren't going to have people coming in just to use the bathroom. I don't have an answer for that.
I mean, my guess, and one of the things that we often recommend is, if you're in a public space and you're doing things, that if you have a buddy, you can do the buddy system of going to the bathroom. So if a coffee shop is open and allowing people to use their bathrooms, and if those bathrooms are gendered, you could have a buddy come in and, like stand outside the door, just to add some extra safety for folks. And hopefully more and more people are having gender neutral bathrooms. So it's not an issue, but I just think the challenge for a lot of trans folks is the appropriateness of trying to stay hydrated, which is just so critical, and then the reality of fearing or having discrimination happen in those public bathrooms. So again, one of those things to weigh, and people need to make their choices around that. Okay. Can we talk a little bit about yelling, chanting, those things that people do at rallies that make noise? Can you share a little bit about what those risks are for yelling and chanting?
Yeah, I think one of the, I was going to say cool, but I'll say interesting things that happened pretty early on. I think it was in March. This happened in, I think, Washington, which had some COVID cases kind of early, the state of Washington. And so in an article, it was described the case of a choir that was rehearsing, and there were about 60 people in the choir, and over the period of what was about I think a 1.5 or 2 hour choir practice. Well, they didn't know at the time, of course, but within the next week, 50 out of the 60 people got COVID or suspected COVID. And there were actually 2 deaths from that, which is about a rate you might expect. And so what, one of the early conclusions is that, anything that produces additional, projectiles from our mouths and our respiratory tract really is where it comes from, is going to increase the likelihood of transmission. When people sing or act or yell or whatever, people really do project much farther than when they're talking. And when I say project, I don't mean in the sense of volume. I mean the sense of how far their secretions may travel in space. And so that's a consideration. Of course, inside in a building, in a choir practice, people, again, we described before how there's more risk in an indoor space where the air is just kind of more still, as opposed to outdoors when there's air currents moving things around that could work either to the advantage or disadvantage. What we think that outdoor spaces are generally safer, but it could in some cases provide a little bit of a twist on that, where if there's a steady wind, and it may actually carry some of the respiratory particles farther in a particular direction than the kind of 6 feet we usually discuss. So anyway, to get back to the original question, we do know that yelling or chanting or singing or whichever of those things is going to produce more respiratory particles that will travel farther and increase the risk of infecting other people. And so masks probably help with that, and on both ends. But that's just, I think, an inherent risk of being around groups of people that are doing any of those activities.
I think this goes back to what we said a number of times, is calculating your risk and choosing which things are most important. And so, again, these are things that we've considered in our family that has caused me to be the person that stays on the edge. I choose not to chant, which is extremely, I will say, difficult. That's a cathartic part of coming together as a group, but it's a conscious choice that I've made not to do. What happens is I end up at marches sobbing because I truly, I can't get it out. So I just stand there quietly crying, but it's at least contained on my face. So I think, making the choice whether you want to chant, and then being strategic about where you place yourself, because often there is a larger subsection that, of folks who might be leading that chant, and, how do I strategize where I am in relationship to that? Honestly, for catharsis, we've taken a lot of work to make signs. So that way, right, that's a way to get out some of what you wish you were yelling if you're choosing not to to chant or yell. It really is like, which pieces do you want to add to the experience, and which pieces are the ones that you want to hold back on as a process of eliminating or reducing some risk.
Yeah, that makes sense. And I know some people are bringing like drums or cowbells or things like that they can add to the noise of the event or keep up the rhythm, but they're not yelling then, so that they're feeling like they have that outlet. Maybe they're sitting and crying too, but they're at least being able to like physically move some and seem to be participating in the rhythm of the chanting without actually speaking. I'm thinking about this too with sometimes there are like police confrontations. And so what if the police are yelling at you and they're not wearing a mask or they're not maintaining 6 feet? So like some of those things are like, not going in the same direction. Are there ways to try to, like avert your head, or what are some of the strategies if you have an unwanted person yelling or talking loudly at you?
So, I mean, as we discussed, if a person has a mask on, that's going to reduce the risk overall, including if someone is approaching. I guess if someone were actually just yelling right towards you, I would choose one of several things, which is to, turn around or like back up or walk away. I realize that in those moments that may not be what people want to do, based on, what the activity is. So, then at that point it's a choice as to, what is the most important thing to the person at the time. But so if it's the overriding activity of like having a confrontation is more meaningful than backing away, well, that's a choice that a person has to make. But of course, as we discussed, moving away, turning around, would reduce the risk of COVID. So I think that just to be placed in the context of, what a person is wanting to do.
That's cool. And I was thinking that too, that the ACLU has legal observers who try to help in those interactions, if there's law enforcement interaction with a person, to try to help keep that law enforcement officer 6 feet apart, and to try to help reduce risk as well as reduce the other types of risk associated with interactions with law enforcement. Okay, so let's switch gears a little bit. So we were talking about chanting and yelling. A lot of protests have microphones or megaphones or other things that make things louder, and oftentimes those are handed between people to continue the loud chanting. So what are some of the risks, or what are some of the ways to reduce the risks when somebody's handing you something that's right up to your face?
So I'll say, it's important when you use a microphone, of course, you get it near your mouth, but of course, try to not actually have it touch your mouth, because then you could directly be transmitting some of those particles that have viruses like COVID in them. So that would be an important thing to do, is to use it, but not get it actually to touch your mouth or your face. Otherwise, the microphone, if you can do that, is the same as any other object that's passed. So you'll want to just clean your hands after you use it, if you can do that. The interesting part about the microphone or megaphone, I guess microphone, let's stick with that, because megaphone I'm not sure about. But microphone pretty much allows people to project their voice without yelling as loudly or projecting their respiratory droplets as far. So in that way, it's maybe a useful tool to perhaps reduce the spread of respiratory particles. So it's probably has its good and bad sides as far as risk and how it affects risk.
Cool. I mean, what I am seeing a lot is people will remove their mask to talk, and then pull it back up. So they're having a lot of contact with touching the microphone, touching their mask, pulling their mask back up. So, again, to remind us of what you mentioned before, is we want to try to not be touching our mask a lot, not moving it down below our nose or mouth. So if we can stay masked and microphoned and then wash after we touch it, we're going to be safer than if we do those other things and pull it down. Is that correct?
That's a good summary.
Okay. Well, I wasn't trying to summarize. I'm just,
No, that's exactly.
move forward with it. So, because there are some safer ways, and again, we can talk about risk reduction and what risks do we want to take. And like you said, we're not yelling, so there's not as much projection. So there's some good things about that. I don't know very much about megaphones either, so well, we can skip that, and maybe somebody can kind of extrapolate from what we just talked about and apply it to their knowledge of megaphones. Let's talk a little bit about when we want to engage with others at rallies. I mean, people chat with each other, they want to connect with each other. How can folks engage in conversations? It's loud at rallies and marches, and you can't hear each other very well. How can people interact and talk with each other safely?
So I think this a little bit ties back to that conversation we had earlier about rather than face-to-face, it's not the most natural way to speak to someone, but if you can be more alongside someone so that you can be talking kind of at ears. Otherwise, it's a lot of yelling. But if you keep your mask on, right, we're kind of beating the drum on that one. That reduces risk. I mean, if you want to interact with people, you have to. There's an element of that if we didn't do that, we would not be human. So some of it is just part of it. But keeping the distance or trying to direct conversation this way, staying masked. Andy, do you have other suggestions?
No, I think that covers it.
Okay. That's cool. I mean, because, obviously this is all about risk reduction because, I mean, we're in a public space that there's a lot of people and, we're increasing our risk than if we stayed at home all by yourself with nobody. So, I mean, all of these things are going to increase our risk, but how much do we want to increase and what do we want to do with our behavior? Whether we don't talk to people or whether we chant, or there's a lot of things that we can be deciding. So this is potentially a question that we should ask ACLU and not medical folks, but what if law enforcement decide that they don't want to wear a mask or a face shield? Can we ask them to back up or to put on a mask?
Oh, I think I don't feel qualified to answer that question. I don't know if you can ask them anything like that.
And I think sometimes when we want to ask them that, but sometimes people don't behave appropriately or act the way that we would hope that they would.
Yeah, I think it's a good thing to seek information through the ACLU. I mean, right, there's, depending on who you are, that could be a really unsafe thing. There's a power differential there that honestly, that even Dr. Petrel versus me might be able to say something differently to a specific police officer. I don't know what the rights are of the citizen in the situation.
Yeah, and there's always a difference too between what your rights are versus what people's behaviors actually might end up being. Because some people might be really compliant to that if you say, hey, I don't want to get too close if you don't have a mask. But again, like you said, there's a power differential, and a lot of us wouldn't even feel comfortable asking those questions, let alone whether it's we have a right to ask them. Let's talk a little bit about we protest, we want to go home. What do we do when we get home? We might live with somebody, we may live alone. How do we, Joanna, you mentioned like bringing a bag, stripping off the outer layers of your clothes, putting them in a bag, putting them in the laundry. That's one thing. What are some other things that people can do?
Yeah, I was going to say, like, if people don't have that option, like if they don't have a place to take off their clothes that's outside their house, I think generally, most people can take off their shoes outside of their own door, whether that's outside or, before they go to their apartment or whatever. And then just simply like walking to the place where you have your dirty laundry and putting it in there. So, and then after that, washing your hands. And taking a shower is probably a fair idea after an event around a lot of people. So in that order, like just walking in and taking off your clothes right by where you keep them, and going into the shower after that is, I think, a fair thing to do. And it's accessible to basically everybody, as opposed to if people have an option of taking their clothes off like outside their physical space. That personally doesn't strike me as a really necessary thing to do, is to like take off clothes outside, as long as you don't like kind of come in and take a seat and a few different chairs in your house, and then you kind of spread the things, the germs from the event all inside your house.
Right. And we want to be careful of other risks, like we don't want to moon our neighbors. So like that might enter up into a whole nother realm of things. So yeah, be careful about where you take your clothes off. And yeah, if you're not making a lot of stops along the way, get your clothes off, take a shower, which might feel really good to try to drain all the emotions of that, as well as physically clean ourselves up. So, because I keep on thinking, we were talking about like talking directly into your ear. I keep on thinking, well, what's going to be all over people's ears? Or, is the droplet kind of going to go there? So scrub your ears off. And I'm joking again, but I think showering is a great idea. So people are more likely to be exposed to COVID when they're in a crowd versus when they're not. When should people get tested, or should people get tested?
So there aren't direct guidelines on testing after an event, but we could talk a little bit about the time windows and some other considerations, and then I think go from there. So if a person has a potential exposure, they may show symptoms themselves, or even if they don't have symptoms, some people go through COVID without really any symptoms, but they are probably at the point where they have active virus from about 3 days after an event till perhaps 10 to 14 days. We could say 14. So if there were an opportunity to get tested in there, I would say in the like kind of 5 to 7 day range, if that was the point, was, I don't know, before a person were going to engage, let's say a person who are at higher risk, like an older adult or someone with other medical conditions, that would be about the range to do it before going to be around somebody like that. So that's, I think my general take on it is, there's not advice to like particularly get a test, but that is the time window, I would say, to consider getting a test.
And we know that sometimes people live. Could you want to go ahead? Yeah.
I was just going to say, Andy, could you talk about what I do what symptoms would I experience first potentially? What do I do if it's different between, should I just get tested whether I have symptoms or not, versus what if
Sure.
I think I'm experiencing symptoms, and how would I
Sure.
know?
Sure. So thanks. So right, I mentioned already that some people will just have no symptoms, and those people, like, there wouldn't be any particular indication to get tested unless there was a logistical reason, like that they wanted to be around other people or something, as I mentioned. But the kind of symptoms that we encourage people to look for as far as what COVID could present as are things like fever and chills. Some people may get respiratory symptoms like a runny nose or a sneezing. Cough is, of course, a big one with COVID. Cough and shortness of breath, even without a cough, can be symptoms of COVID. We're also seeing some people get like GI symptoms, like diarrhea or other kind of GI upset. So those would be the main symptoms to think about. And of course, if a person had been at an event or any place where they may have been exposed to COVID, even if it's just someone they know that they find out about later, those would be a good indication to get tested. The point of that is to find out if you have it yourself, and then keep yourself away from everybody for the next 2 weeks.
So I kind of want to go two places. One is if you start having symptoms, you have a job and it doesn't have sick pay. Should you continue going to your job? Should you get tested? What kind of, are you going to be exposing people if you have, if you feel a little flush, you might have a fever, if you're coughing a little bit?
Yeah, so you can definitely expose other people to COVID, but especially if you have symptoms, but even if you don't. So if you suspect that you do have it, I would probably encourage people to tell their employers that they're feeling unwell. And right now, most employers are pretty attentive to this because they don't want the rest of the employees to get sick right now, because that has a potential to really kind of devastate a business. So even regardless of what their usual policies may be, I think many more employers are kind of getting the importance of this for their own well-being. So bringing that up, right now there are a lot of places to get tested. You could look those up online, but the testing is often free, often drive-through. There's at least 2 or 3 locations in the city right now that have drive-through free testing. So I think, kind of putting it out there, and like the advice is, if you have symptoms, you should not go anywhere, and you should get yourself tested in a like drive-through situation, and you should stay home until you get your test results. And if they're negative, great. And if they're positive, then you should be at home for at least 10 days after you start having the symptoms. And that's a discussion with a medical provider that you would have when you get your positive results.
Andy, if I have, this is a little off, but maybe not. If I have symptoms, but my test comes back negative, does that mean I'm in the clear, or should I get tested again? Like, should I behave like it was positive if I'm continuing to have symptoms? Are there other things going around? You know what I mean?
Yeah. So the testing is it's a nasal swab generally for testing that looks for the presence of the COVID, SARS-CoV-2 virus, is generally very good, but of course it's not perfect. So if a person has symptoms that resemble the things that we've talked about, then it's possible to stay home even if they have a negative test until they're no longer having symptoms. That's great advice, because whatever else they may be having, it's a great idea to spare other people from getting whatever that is, what other like viral illness it could be besides COVID. So the tests can generally be trusted to be in the kind of 90% as far as accuracy. But again, if a person's sick, best thing to do is to stay away from other people. There isn't, just to answer the question you asked in there isn't really guidance as far as like, should you get tested again? So at this point in time, we don't have enough information to say anything specific about like retesting in light of a negative test.
So if there's a positive test, obviously we want people to stay home. We want people to take care of their health as best as they can. What happens with contact tracing when somebody's been in a protest that has 2,000 people?
I can speak a little bit to that. So contact tracing, the responsibility falls to the county that the individual lives in. And candidly, they are scaling up their staff, but they're not there yet. And so as far as I know, as of today, there has not been an outbreak directly tied to a major event like that. But in other areas across the country where there have been events that have had outbreaks, the public health for the area and for the state have essentially put out a blast saying, someone at this large event tested positive. If you attended this event, you could be at risk. Please get tested if you have any symptoms, yada, yada, all of that. So I imagine that if something like that happened, in correlation with a protest, we would follow that same practice. But individual contact tracing beyond, you can't necessarily individually contact all 2,000 people at a protest. But if you do test positive, they're going to want to trace people you've had contact with, regardless of, that large event, but also in your life around you, whether there's people in your household or, maybe you were going to work or you did go to the grocery store or whatever. And so contact tracing would happen with an attention to detail to those things that they could.
Okay, that makes sense. I'm just thinking too that, here in Milwaukee, we just had a really large queer-focused Black Lives Matter march. And we know of several people that have tested positive since. And so it's like, they're trying to stay at home, they're trying to do whatever. And I know some people have not been able to fully stay at home, but, they were in a crowd. And so, we as an organization, caring about people, are really worried about what's going to happen with those that they were around. So that's not really a question, just a, kind of an observation of, there likely were positive people, and now that we know that there are positive people, what is happening? And so, like you said, I haven't seen any public announcements that have said, oh, we have 3 people that were positive at this march. I haven't seen any announcements from like the health department. So just,
Yeah, I will say the caveat, right, is that our health departments are understaffed and trying to catch up. And it's such a hard, not that that's necessarily an excuse, it's just an acknowledgement of, even lab backlogs are happening. And so we're getting much better. I don't work for the health department, but like as a state, I know we're getting much better from everything that we hear, but I know they don't have everybody they are supposed to have, and they're scaling it up. And, I just think there's some forgiveness there in terms of, yeah, there probably should have been some sort of blast about that. I can't explain why it didn't happen, but.
Right. And, if it doesn't, it doesn't. And then we go back to the beginning of our conversation, which is, how do you individually protect yourself? So, obviously, if you've been exposed and you have symptoms, you may want to get tested, you may want to, all of those things, but you still want to be protecting yourself and protecting others by wearing masks and having good hand hygiene, all of those things. So it kind of is a circle of things.
Yeah.
I think it's useful to point out that, our models around contact tracing originated around things like STDs and that's a lot of and like tuberculosis and things like that. And I actually don't think that there's really any feasible way to do contact tracing at events with thousands of people, except for what is, I think, the future of contact tracing, which is using electronic data. And I know that Google and I think Apple are working on this. And there's, I think, some legalities to work through, but more or less what that would look like is that, if a person tested positive, that there would be an automatic anonymous notification to everybody that that person's phone had been near over whichever period of time you want to set it to tell them that they were near enough to a person to be exposed. And really, especially when you think in the context of an event with thousands of people, there will be really no way for any number of public health employees to keep up with that. So I think that the future is really in electronics, and people with different viewpoints need to sort out how to implement that and the legalities of it. But that's what it would really take, and that's really kind of a modern day way to do contact tracing rather than doing interviews and phone calls after that.
And like you said, there's a lot of legalities, and it freaks people out, I think, to think that they're being followed or, what their information is. But that's a separate issue than looking at the public health and actually being able to trace and figure out how things are spreading and who might be at risk. So we've talked about a lot of heavy things. I'm wondering if we could kind of end on a little bit of a maybe positive, which is that, a lot of times we get really excited to be at events where other people are similarly minded, and we might want to hook up with somebody that we've connected with. How can we do that safely? I know that's a really big conversation, but, we find some cute one that we want to say, hey, I really like you. I want to go have coffee with you, or I want to do more than have coffee with you. What are some protocols or some general guidelines that people can hook up?
So I think they're generally the same as the things that are applied to other types of interactions. That is, doing masks and social distancing of the whole 6 feet is what's recommended. Of course, if a person chooses to go kind of beyond casual interaction, the spacing and all that is not likely to be kept, depending on the types of activities that are done. There are certainly ways of reducing the overall exposure to respiratory secretions, as one might imagine, depending on the type of activities that people decide to engage in. I feel like we could probably have a really long talk about this topic specifically. but of course, like any activity where people's faces or mouths are near each other is going to be like more likely to transmit, in this case, COVID, than other types of activities where that wouldn't be the case.
Okay, let's have a longer conversation about it. But I do think that people really enjoy being with people that are similarly minded, and we know what happens when folks get excited to be with each other. So let's talk about the sexual dynamics and romantic dynamics that might happen for people that are hooking up or people that are in longer term relationships, and we can have that conversation later, which is cool.
Great.
This was a really fun discussion, I think, about what's going on currently. Do either of you have more that you'd like to add about protesting, staying safer, what folks may want to think about or do?
I just think to summarize, what we've gone over is just kind of deciding where you want to place your risk, and knowing that there are opportunities to support protests beyond participation directly in the protests. It can be really difficult right now for folks who are not comfortable protesting, who have a pre-existing condition, who aren't able to be physically maybe as mobile, and really, really wanting to contribute to the collective voice that we're putting out there. And so being creative in how you support that work can be fulfilling for people who choose to do it differently. And then for folks who are really engaging, this is really just about finding the areas in your activity and in your life where the risk is important, and then maybe backing off risk in other areas, kind of that risk reduction, harm reduction model that we're shifting it into the COVID world outside of the way we've thought about risk reduction in other parts of healthcare in our lives.
Yeah, that's great. Thank you.
I think that's a great summary. No, I think, it's just what we've done here is try to describe the risks of different kinds of things and how we can reduce them. And, people will choose all kinds of different activities that are important to them and make kind of life worth living. And, hopefully what we've done is given people a little bit more information about how to think about those, how to balance their kind of wishes with their desire to reduce risk of, in this case, COVID.
Perfect. I am really grateful for both of you to spend this really extended period of time talking about things that are really important and really, really critical for our world right now. And we're all making a difference in all of our different ways that we contribute. And it was really good to have a discussion about how folks can stay safer in what they would like to do and assessing their risk levels and harm levels. So we will have some future conversations based on some of the things that came up today, and folks can look out for some of those future conversations. This is recorded, so folks can listen to this recording, folks can listen to prior recordings that we've done in our partnership together. So thank you both for being here, and thanks folks for listening. Have a good day, everybody.
Thank you.
Thanks.